Before we begin, I'd like to introduce the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Marla. Good afternoon, everyone. I'm speaking to you from my home in Pictou County. Well, we're seeing firsthand how quickly things can change. That's why we're here today. Between the high number of cases we're seeing, between the hospitalizations we're seeing, and healthcare workers being off isolating as close contacts, we need to go further than the restrictions that had already been announced. We need to tighten up to make sure that we do what we can to minimize the spread, to protect our vulnerable, and to make sure that we don't overwhelm the healthcare system. So Dr. Strang will go into some detail on some new restrictions, but I want to point out a couple of things off the top. Number one, we need to change our approach to testing. We've been leaders in testing, and Nova Scotians love to test. Thank you for that. But the reality is we don't have an unlimited supply of tests, and we need to continue to lead in testing. But this time we need to be leading in very focused testing. So right now is the time to make sure that we have tests available for those that are symptomatic. We need to do this to support our lab team. So we'll talk about a testing strategy, but please don't hoard the self-tests, the home tests. We'll continue to lead, but it'll be leading in focused testing. Number two, the Omicron data is coming in from around the world, and there are differing opinions on the severity of the illness. Our reality here in Nova Scotia is that we are seeing hospitalizations. We started to see hospitalizations this weekend, and now we have 10 people in the hospital since the outbreak started 2 weeks ago. 10 people might not sound like much, but it's certainly an increase against the backdrop of the well-known stresses that were already on our healthcare system. And so we need to take steps to support our healthcare workers, and we need to take this increase in hospitalizations very seriously. And the third thing I want to talk to you off the top is, we're seeing human resource issues impact service. It's not necessarily that people are extremely sick, but it's that they're having to isolate. So we're seeing this in healthcare, but not just in healthcare, other critical systems and first responders and essential services. We're seeing it in police, fire, transit. We're seeing it in many places. There's a lot of people that are off work because they're isolating. So we have to take steps now to really slow down the spread and to protect all of these services. So all of these facts point to the need to tighten up. So tighten up is what we'll do. It's that simple. COVID has asked a lot of our essential service teams. They've been flat out for almost 2 years. They've had no slow periods, no breaks. These are our family, our friends, and our neighbors. They're hurting. They're under pressure mentally and physically, and they have been for a while. So we're asking a lot of Nova Scotians. We're sorry to do that. I'm sorry to have to do that, but we have to tighten up the restrictions. There have been many questions about boosters. We'll tell you this: public health is working to do whatever it takes to get booster doses in eligible arms. It's important these boosters are important to combat the variant, but they're also extremely important for our collective mental health. The political decision, almost the easy thing, would be just to simply say, we'll get doses in everyone's arms right away. But that's not the right move. Not only is it at odds with the science, it's just not practical. The supply is not there. Look at the Hunger Games type environment that we're seeing taking place in other jurisdictions. That benefits no one. So saying you can get a booster just so that it sounds good, it doesn't help anyone. The right move is to stick with the science, just like we always have here in Nova Scotia. And the science we focus on is advice from NACI. And we have in Dr. Strang, we have the best in the country. So we'll continue to listen to Dr. Strang and focus on the science. It's always served us well in the past, and it will serve us well going forward. So what the science does say is that the booster doses are most effective for anyone 18 and older if it's been at least 6 months since their second dose. So we'll stick to that 6-month guidance. But here's the reality. By mid-January, almost 640,000 Nova Scotians will tip over that 6-month mark. They are not all there today, but over the next few weeks, they will be. And those people are our primary focus. But we don't have 640,000 booster doses. We're working with the federal government to increase our supply, but so is everyone else. So today we have around 100,000 doses. And so for this reason, and to avoid the Hunger Games type scenario here in our province, where the most vulnerable, we want the most vulnerable to get their booster first. So what we can do is we can open up to those over 50 and over 6 months, and we will do that tomorrow, effective tomorrow. That cohort alone, over 50 and over 6 months since their second dose, that will consume those 100,000 doses. For everyone else, I want you to know we're working with the federal government, and we hope to have the necessary doses in time to meet the need over those next couple of weeks. We've requested those doses, and as soon as we get those massive quantities, we will open it to everyone that meets the NACI eligibility of 6 months. But between today and then, we have to be smart with what we have. If NACI changes its guidance, we will too. And again, we'll be working with the federal government, but we're not in the business of doting NACI. There's no need to dote the 6-month eligibility criteria. We won't, and you shouldn't either. 6 months is the trigger, and we're working with the federal government to get those doses. So, and I can promise you that the team at Public Health and the department and our team, we're working tirelessly to ramp up. It is going to take time, but it's coming. It may take time to get your appointment, but we're looking at the supply, and once we have the supply, we'll get things really rolling. So it doesn't do anybody any good to allow appointments to be booked only to find out later on that they can't be filled. We don't want it to go there. That wouldn't be fair. We will have new appointments opening as soon as we have the certainty over the supply. Minister Thompson spoke with the federal minister yesterday, and again today, and I think those discussions are probably happening right now. We're pushing for those doses. So we'll work to increase the speed of boosters. The team has accomplished a lot this month already. I don't want to give the impression that there's not a lot of boosters have gone in. You know, as children became eligible, they were getting their shots. The immunocompromised, those who live in long-term care homes, those that have been over 60, frontline healthcare professionals, these have all been the focus, and that was the right focus. And now we'll expand that focus, and we'll continue to push for supply. So I don't think anyone would argue that getting these key vulnerable groups back with their boosters and vaccinations first was the right way. So we'll expand the focus. The boosters are coming. I can tell you that Dr. Strang and Public Health and myself, we met with Ian Rankin and Gary Burrell this morning, and we have a few takeaways from that meeting. Some great points were raised there. One of them was around paid sick time, and we're already working on looking at ways to stand up the old program again. And we've reached out to the federal government so we can all be on the same page as we were last time. So there's a lot that's moving. The ask of Nova Scotians is just be extra cautious while you wait for your booster. Be extra cautious in limiting your contacts. That's something that's in your control. That's your decision. So please slow down. Please be cautious. I know you will, and we appreciate it. Dr. Strang?
Thank you, Premier, and good afternoon, everybody. If you'd asked me in November what I thought of the holidays would look like, I certainly would not have come close to imagining where we are today. Until Omicron, Nova Scotia has, or we were set to have a relatively smooth holiday season. Instead, we are battling a new variant and moving backwards, unfortunately, not forwards. What we know about the Omicron variant is impacting our province, and how it is doing that is changing as fast as the virus is spreading. The restrictions that we announced last Tuesday just will not be enough to protect our healthcare system and our most vulnerable. Cases continue to rise. Hospitalizations are starting to increase. And we now have outbreaks in 2 outbreaks in hospitals and several in long-term care facilities. And we have staffing shortages throughout our healthcare system and other critical services, with many people either being sick or isolating. So this is just not sustainable. And we need to lock down even further to lessen the impact and make sure that we have the staff that we need to provide care to Nova Scotians when they need it. So new restrictions will be come into effect at 6 a.m. on tomorrow, Wednesday, December 22nd, and will be in place at least until January the 12th. We will continue to monitor things closely and regularly reassess the need for any further changes. So I'll give you an overview of the new restrictions now, and you can find full details in the press release that has been issued today as well. But first of all, the distancing and masking requirements announced last week remain into effect. We are lowering the informal gathering limit to 10 people from the same household or in a consistent social group. I know this is not welcome news to people with big families, but our goal is to slow things down and limit our contacts. Larger groups do the opposite. They give the virus more room to spread. Festivals, special events, sports events, and in-person performances will be paused. Groups of 10 indoors and 25 outdoors can participate in sport practices and training, but spectators, games, and tournaments will not be allowed. And the same group sizes will be allowed for arts and culture rehearsals and for virtual performances. But again, no spectators, no performances or competitions, and no competitions and no in-person performances will be allowed. For events held by a recognized business or organization, the gathering limit will now be 25% of legal capacity to a maximum of 50 people indoors and outdoors. So this includes things like faith services, wedding ceremonies, funerals and associated visitations, movie theaters, meetings, and training. For weddings and funerals, receptions will not be allowed, but we allow the actual ceremony and with funerals associated visitations. It's important at this time of year, but in-person faith services will only be allowed to have one person singing. We'll not allow choirs or congregational singing, and that's simply a reflection of singing significantly increases the likelihood of spread of a virus into a shared airspace. And food and liquor license establishments like bars and restaurants, if they have performers, will only be able to have one singer. Places like retail businesses, malls, museums, libraries, and recreation and leisure businesses and organizations will be able to continue to operate, but at 50% capacity. And for them, that they previously established plans to with directional arrows and other things that help control the flow of people and keep distancing. We're asking them to put those back into place as quickly as possible to manage that 50% capacity. Fitness and recreational facilities can continue to operate at 50% capacity, and that's in recognition of the importance of people to have opportunities to maintain their physical and mental health. And we will allow one-on-one personal training to continue. Food and liquor license establishments can continue to operate, but at 50% capacity, and there needs to be the required physical distancing between tables, and there will now be a limit of 10 people per table. And as well, they will have to stop dine-in service at 11 p.m. and close to any seated service at midnight, but takeout and pickup will still be allowed beyond midnight. Personal services like hair salons will be able to continue to operate at their maximum capacity with physical distancing, but services that require the removal of masks by the client will not be allowed to be offered. We also need to make some changes to the restrictions that protect vulnerable residents in long-term care homes. We will now have a limit of 2 consistent visitors per resident. So we'll still, the importance of still allowing social interaction, but families and friends will have to choose 2 consistent people to be the visitors, and 1 or both of those could be also be the designated caregiver. Residents will only be able to leave the facility, their residential care facility, for medical appointments, or for a drive in a facility vehicle, or a drive with one or both of their 2 consistent visitors, even if those people, the residents, are fully vaccinated. It will only be residents who have had a booster dose that will be able to access service providers within the facility for recreational activities and personal services like hairstyling. It's certainly much easier to read off this list of restrictions than it is to implement and follow them. But I'm asking for everybody's support and your help to follow these, to understand them and follow them, to help us slow down the spread of this very infectious variant of COVID-19, to protect those who are more vulnerable in our healthcare system and other critical services. Next, I want to talk about some of the important changes to our testing program. These changes do not come easily. We have built our pandemic response with a key component of testing, and that has been recognized nationally and internationally. And certainly the commitment of Nova Scotians to testing has been incredible. But Omicron and the challenges it's presenting is forcing us to change our approach. Before I share the details, I do want to address some concerning behavior that's been reported from staff and volunteers at our various testing and distribution sites. There have been numerous reports of people being physically and verbally abusive, making physical threats, and even stealing test kits. This is just not acceptable. We've gotten this far caring about and supporting one another by making personal sacrifices for our collective well-being. So please, let's not stop that now. We do not have an unlimited supply of rapid test kits. We are working rapidly to get as much as we can, but it's not unlimited. Across the country, it's not unlimited. And we only have so many people who can staff assessment centers without borrowing from other parts of the healthcare system. And our lab has limits as well. These are facts we can't change. We have to deal with them. Therefore, we need to change our testing program to make sure that the people who need tests the most get them first. That means we will be limiting PCR testing to people who have symptoms or are close contacts and are at increased risk for severe disease or live in a congregate living setting or are integral to keeping our healthcare system running. For everyone else, even those with symptoms who aren't in one of the above groups, you will need to start using rapid tests. If your rapid test is positive, you will no longer need to do a follow-up PCR test. You assume you have COVID and then follow with isolation and notifying your close contacts. People have become used to using rapid tests. I acknowledge that, and using those to make sure they don't have COVID. We encouraged you to do this, to stay safe over the last number of weeks and months, but that was before we knew what Omicron would bring. With the volume of cases, we need to prioritize our supply and prioritize our whole testing capacity to ensure that those who need a test get one and get a timely return of their result. So this means we will no longer make rapid tests widely available. We won't be restocking public libraries or any other places where we've had ready access to rapid tests. We're also pausing our workplace testing programs in lower risk workplaces. So if you're going to hospitals or pharmacies looking for rapid tests, please stop. You won't find any there either. And please do not hoard or stockpile the existing rapid tests you have. Only use them when you need to. And please share them with others if you have a supply, if they need one for the testing reasons that we've outlined above. I certainly appreciate all Nova Scotians' commitment to testing. We have done, you've done this because we've asked you to do this, but we now need to change simply because of, as I said, the pressures and the requirements of Omicron. We will have more to say about this later this week. We're working out some of the final details, including how exactly we will distribute rapid test kits. So those who need them because they're symptomatic or a contact, they can get a rapid test kit. This new approach will take effect December 22nd. But I want to reassure people moving forward that if you meet the criteria for a test, whether it's PCR or rapid test kit, you will have access to one. But we have to put limits on how we're using other types of testing that are lower priority. The situation with Omicron is also making a booster dose that much more important. The Premier has asked us all in the health system to pull out all the stops to make this happen more quickly. And we're talking to all our partners and urgently working on solutions to get booster doses into arms as quickly as possible, and as soon as people are eligible at their 6-month mark. We've already opened up additional appointments for booster doses for those 60 plus in the last few weeks. And later this week, 75,000 appointments will open for early January. Also in January, any unfilled pediatric appointments at the IWK clinic will be converted to appointments for adult booster doses. And our mobile outreach team will start giving out more than 4,000, we'll give out about 4,000 more vaccine doses every week. So starting this Thursday, December 23rd, booking will open to those aged 50 to 59 who have reached the 168 days after their second dose of COVID vaccine. We asked everybody else, those under 50, to please be patient. We are working as hard as we can to get more vaccines from the federal government and to add more clinics and appointments. Our goal is to open booster dose appointments to those under 50 as soon as possible in the new year. But as the Premier said, we have always followed the principle that we will not open appointments until we had certainty of vaccine supply from the very beginning of our vaccine program. That has served us well. We have not had the confusion and disappointment and frustration that many other jurisdictions have had by getting their appointments ahead of their vaccine supply. But we are working as diligently as we can to increase our vaccine supply as quickly as possible. I want to end today speaking to you from my heart. This is a worrisome, sad, and frustrating time. As your Chief Medical Officer of Health, I feel immense pressure to make the right decisions to protect Nova Scotians and to find the best balance to minimize harms from COVID and COVID control measures. I'm not going to get it right every time, and in retrospect, perhaps we did not get things quite right last week. Things are changing fast with this new variant and there is limited information. But please know that my recommendations and decisions always have the best interests of all Nova Scotians in mind. So again, I'm asking for your help and your continued support to our pandemic response. What we're asking you to do now is probably the most difficult request we have made yet. This is a long 2 years and there's a lot of disappointment about having to do this yet again in the holiday season. But that is our reality and we have to deal with it. So I hope you take advantage of a quieter holiday season to slow down and reflect on what is most important: friends, family, and good health. Hope is fundamental to the true meaning of Christmas. And so I ask all Nova Scotians of all faiths and beliefs to keep your hope and your love for one another. Care for one another, be kind to one another, support one another, and we will get through this. And I'd like to pass on to all Nova Scotians my sincere wishes for a happy, healthy, and slow holiday season. Back to you, Marla.
Thank you, Dr. Strang, and thank you, Premier. We'll now take questions from reporters. We have a number of reporters on the line, so we'll do our best to get to as many as possible in the amount of time that we have. We'll start with Graham Benjamin with Global. Go ahead, Graham.
Hi there, thank you. Question for the Premier. How close are we to imposing border restrictions with the other Atlantic provinces? We've seen Newfoundland and Prince Edward Island take these measures. Are we close to doing that before Christmas?
I'll ask Dr. Strang to kind of elaborate, but the answer is we're not focused on border restrictions right now. Obviously, I respect Newfoundland's decision and PEI's decision. They have a bit different situation. They're islands, they're a bit different stage in this kind of outbreak. But where we are right now, I mean, we have 500 cases a day for four plus days now, record number of cases. We have a lot of COVID around us, and that's certainly not a great feeling. It's a reality. So the border measures tend to be effective when you're trying to keep COVID out. But we have it here now, so we're focused on the restrictions, and just don't forget that there's been border restrictions in place all along. If you're not vaccinated and you're coming into Nova Scotia, you still have an obligation to isolate. So I'll get Dr. Strang to elaborate, but it's not been a topic of our recent discussions that border restrictions at this stage would help us get through this. Dr.
Yeah, no, the Premier's right. I mean, the border is, and what PEI and Newfoundland are doing is to help keep the virus out. And, I talked with Dr. Morrison and PEI earlier today, and they're still seeing most of their cases are coming from people traveling into the province. So they're in a very different place. Unfortunately, we have a much different and higher level of COVID. And in fact, we were exporting COVID to New Brunswick and PEI a couple of weeks ago. So we always, say, is there any restrictions we put in, are they necessary? Are they needed? And certainly at this point in time, border restrictions have a lot of negative impacts and are not going to have any real substantive benefit to our COVID response.
Graham, do you have a follow-up question?
I do, yes. I just wanted to ask Dr. Strang just about the testing strategy and the changes there. Just we're seeing, for example, this morning, just over 500 people in Bedford, all waiting for rapid tests. You also said there's some stockpiling of testing happening as well. Do you feel that there's just been this over-emergence of reliance on rapid testing over other health and safety measures like masking, sanitizing, physical distancing, things like that?
So, I mean, I think Nova Scotians, we've asked them to add in regular testing to part of their COVID response, and we've done that for the last year. So, I'm not, we're not blaming people for that. They're doing what we've asked, but circumstances are now different. But it is also important that people are. I'm certainly hearing anecdotes or people saying, "I got a rapid test that's negative, therefore I'm okay." Omicron is even more because it's so infectious. You could have a rapid test today and be negative, and tomorrow you'll be positive. In fact, we're dealing with a cluster of cases that a bunch of people who, believing they were doing the right thing, did rapid tests a few days ago, all went to a party together. Well, now we have a bunch of them are tested or positive cases because many of them just tested positive the next day. So rapid testing has its place, but it's critically important that people stop their social activities as much as possible. Do not use rapid testing as a reason to say, well, I'm okay, I'm negative, I can go continue my social activities. And therefore, we're asking people to change their behavior around around getting tests and then how they use those tests. We need to prioritize people who need to have a test because they're symptomatic or other reasons, need to have access to either PCR or a rapid test kit, and people who don't need those tests should not be looking to get rapid tests moving forward.
Just if I could on that, Marla, I think this is a really important question because the Nova Scotians have taken great pride in their testing, and it's a community service really. But with this variant, if a person is exposed to COVID this morning and they test tonight, they're going to test negative. If they test tomorrow, they're going to test negative. And the day after, they're going to test negative because the virus has to be in a person's body, kind of growing, I guess, to use a technical term, for at least 72 hours. So we're seeing people test every day thinking they're fine when really they need to be watching the calendar, thinking about their contacts, thinking about their own exposure, and testing at the appropriate time. So Nova Scotians have done what we asked, but now the ask is that we do focused testing because the testing is a peace of mind. But if you're not testing at the appropriate time, it's a false sense of security, and there's no room for a false sense of security in this environment right here. So we have to be smart with our testing. We'll lead in testing, but it'll be in focused testing, and we just need to kind of share that educational piece with Nova Scotians, because we do hear a lot. I tested negative 2 times in a row, and then I've tested positive. Well, that's because you tested at the appropriate time in that last test. So thank you for asking that important question about testing.
Thank you. We'll go to Keith Doucette next with the Canadian Press. Go ahead, Keith. Keith, are you there? Okay, we'll come back to Keith. We'll go to Jean Laroche with CBC. I think we might be having trouble with our mute button here.
My apologies. There we go. All right. Dr. Strang, I'm going to start where you ended this with a bit of a mea culpa about last week. What should or could you have done last week that would have made things any better this week?
No, I just wanted to point out to people that people who are looking at things in hindsight, that maybe we should have acted differently a bit harder. We're hearing that criticism, but I just wanted to let people know that we're aware of that. We're always trying to make decisions on the best information and try to find the right balance. And in retrospect, in hindsight, that maybe we didn't get the balance quite right last week. But again, a lot has changed between last Tuesday and today as well. So I just want people to hear that we're always I always continue to question and ask my team to question, do we have things right, and did we get that decision right? So and just looking backwards, sometimes you go, oh, maybe we could have, maybe we would have done exactly the same thing. But just people to know that we're not just making decisions and just believing we're absolutely got it completely right. But these are very difficult times with rapidly changing information.
John, do you have a follow-up question?
I do, and I apologize if it's going to sound like I'm picking on you, Dr. Strang, but last week, it seems to me you said that supply wasn't an issue in terms of vaccines, nor was staffing. How did that change in just a week?
No, we were talking about where we were at the current time. We had always been working on trying to increase our supply and into January and increase our vaccination capacity. But we've been focusing our vaccine efforts through November and December in some major other areas, kids, immunocompromised, and the long-term care facilities with additional doses of vaccine, and doing as much as we could 60 and above with booster doses. And we are going to be shifting some from those other areas into more emphasis on booster doses. But moving forward, we clearly know that we need to get more vaccine, and as we will build capacity to deliver as much vaccine as we can get.
Okay, we'll go back to Keith Doucette with the Canadian Press. Keith, are you there?
Yeah, Dr. Strang, I was wondering, in terms of numbers per 100,000, can we put this in context for Nova Scotians in terms of the severity of the outbreak here? Are we in fact the highest in Canada at this point in terms of our outbreak?
I haven't looked at that directly. I've seen some stuff, and the people have told me. I haven't seen the data directly that we are among some of the highest rates in Nova Scotia, and certainly in the Halifax area for 100,000. But it is what it is. So that just highlights the seriousness of the situation we have, and why we have to focus on controlling this as quickly as we can, and keeping the level of spread within, quite frankly, the capacity of our healthcare system to deal with even a very small percentage of people getting more severely ill. that we have to keep that within the capacity of our healthcare system, and both for COVID, but also if our healthcare system gets overwhelmed, then there's all sorts of other non-COVID healthcare needs that can't be met effectively as well.
Keith, do you have a follow-up question?
Yes, I do. And in terms of holiday season travel within the province, I don't think I heard you say anything about that. If you did, I must have missed it. But I'm just wondering what your advice is to people who may want to drive from one community to another at this point. What can you tell us about that?
I'm hoping Nova Scotians can understand that we're saying slow down, limit your social contacts. That clearly means be careful and be thoughtful about what kind of travel you're doing. That to me would be inherent and part of this. Just slow down, stay close to home, stay in small groups. We will get to see your broader family and your friends and across the province, at some point in 2022, but not right now.
Next, we'll go to Sarah Plowman with CTV. Go ahead, Sarah.
Dr. Strang, given where we are now, I was wondering if you could help Nova Scotians brace themselves for maybe what's to come. Like, what would be the best case scenario here, and perhaps what you guys are looking at potentially one of the worser case scenarios in terms of numbers and hospitalizations?
Well, we're realistic. Even if we stayed at around, and we're likely to see our 400, maybe 450, 500 cases a day will be around for at least into next week. And we're seeing 1 to 2 new hospitalizations a day over the last few days. That is kind of the best case scenario, because I think one of the reasons we are not seeing exponential growth in cases is, last week people started to slow down. We put restrictions on last Tuesday that came into effect Friday. So it usually takes about, by the time somebody's exposed, then it's about 4 to 5 days before they get positive. And so we're always 4 to 5 days behind at least to see the impact of our measures. So I think we are starting to see the benefit in, plateauing, where more of a plateauing effect, but still that's at a very high, 450, 500 cases a day will put pressure on our healthcare system. So we have to go further, and what we're expecting to see, and this is all dependent on Nova Scotians really taking to heart what we said last week and what we're emphasizing and strengthening today. Slow down, stay close to home, small groups, only really necessary activities. And if we all do that, we will start to see a slowing down of the transmission of even Omicron. Because even though it's highly infectious, it can't spread if we're following the public health measures. There'll be some spread, but it'll be much lower spread, and our case numbers should start to come down, and therefore our impact and severe illness should start to come down. But we're going to need to stick with this for a few weeks to really bring things back down into a much safer level.
Sarah, do you have a follow-up question?
Yeah. If people don't do that, what's the worst case here? Or not worst, but what could we see? I just want people to understand what we could see here.
Well, if we continue to have ongoing high case numbers and building hospitalization rates, we reach a point where our healthcare system it becomes very, very challenged. From two perspectives: higher numbers of people requiring medical care in hospitals, and worsening of an already existing challenges around getting the number of healthcare workers we need, simply because we have many healthcare workers who are isolating, can't come to work because they are either a case or a contact. So both of those together are not a pretty scenario in terms of the ability of us to continue to deliver fundamentally important healthcare. So it's in all of our best interest to do what we're asking you to do, to follow the rules and your own personal measures, because none of us know when we will need the healthcare system to be there for us or for our families.
Okay, we'll go next to Greg Mercer with the Globe and Mail. Go ahead, Greg.
Hi, thank you. Question for Dr. Strang. Wondering if the province is planning to change its advice to healthcare workers around isolation. In other words, do you expect to move towards what they call a test to stay approach to avoid some of the staffing shortages that you've been describing?
So I know my colleagues in the health authorities, the infection prevention control folks who are responsible for these, are looking at that, how we modify some of that. But at the end of the day, we always have to be cognizant that that if we go too far in this area, we're then actually putting patients at risk of being exposed from the caregivers. So it's a fine balance, but I know they're looking at how the ways they can modify things while keeping the necessary level of safety and preventing transmission from healthcare provider to patient.
Greg, do you have a follow-up question?
I do. How would you describe how pressing some of the shortages are in the healthcare system right now because of isolation among staff?
So, I mean, I know about it at a very high level. I mean, NSH and IWK can talk more in much more detail, but we saw just yesterday that the NSH is having to stop some more less necessary surgeries, day surgeries, and other elective surgeries because of some of the staffing issues. Just because we call them an elective surgery doesn't mean that it's not a very important surgery for somebody. So these start to have impacts already.
Next, we'll go to Patrick Butler with Radio Canada. Go ahead, Patrick.
Hi, the Premier of my province, Newfoundland Labrador, put out a release about a recent gathering of premiers in Atlantic provinces to talk about the situation. I'm wondering whether, you're talking about following the science on the boosters question. Did that science come up and the differing interpretations of boosters, be that who is eligible and the interval between second and third doses? Has that come up in your conversations, given the differences between the provinces?
Yeah, there's always discussions, but for us, we stick to NACI. So NACI's recommendation is at 6 months. That's the optimal time to get the booster. There's some areas where they're at 3 months. Some areas where it's just a free for all. If you want your booster, go and get it. Well, that could be you're 18 years old and you got your second dose the day before. If you want your booster, go and get it. So obviously you can see how these types of situations can lead to what I refer to as the Hunger Games, because I read that somewhere that's actually what it feels like in some areas. So we're trying to be methodical. We're respecting NACI. If NACI changes, we'll change. But right now, NACI is saying 6 months. So that's the key thing that we're using. I know that Newfoundland has said 22 weeks, so 5.5 months, and I certainly respect that decision. That's their decision. Other jurisdictions are doing other things, but for us, we're sticking to NACI. And even at sticking to NACI, look, we have a supply issue now. In talking to the federal government has indicated that there's enough boosters for all Canadians. So we just need to make sure we get them when we need them and where we need them. So for us, it's not a big debate. We certainly respect those that just move a little bit away from NACI, but that's just not where we're at as a province. We're sticking to NACI, and all due respect to other areas, for sure.
Do you have a follow-up question?
Yeah, I do. And you say that the vaccine delivery for boosters is a supply issue. Given the surge in cases that we're seeing in Nova Scotia, could this soon become a capacity issue as well in terms of the healthcare system's capacity to give vaccines?
I don't think so, but Dr. Strang and maybe the department can speak to that. So, look, the reality is there's three issues that need to be resolved to get the boosters in people's arms. Number one, you have to have them. That's the supply. Number two, you have to have the capacity of people to actually inject the boosters. And we're talking to, we'll reach out to the Canadian Armed Forces, we'll reach out to Red Cross, retired healthcare professionals, students, all of those resources we're having those discussions with. And of course, the third thing is, where do you do it? So do you need community halls? Do you need rinks? Do you need mass clinics? And look, we're we're focused on this. We feel the urgency. So I feel confident in saying that if we get the supply, we get the confidence that we have the supply. Having the people to administer it and having the place for people to go and do it, those aren't going to be an impediment. So we're working with the federal government to get that supply here when we need it, and as I said, we need it over the next couple of weeks.
Next, we'll go to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. This is a question for Dr. Strang. As you just noted, Nova Scotia has among the highest number of cases per population in the country. We seem to get to that state fairly quickly, and I'm wondering why, I guess, particularly given our high level of vaccination. And has the Omicron variant been such a factor here that we're getting this number of cases per day? I mean, can we blame it on that variant?
Absolutely. We know our latest batch of variant test results that came back, so that 83% of them were Omicron. So Omicron has rapidly become the dominant piece or dominant variant. I think is an unfortunate set of circumstances where we have this highly infectious variant come into the province and in a location where there was a high degree of social activity amongst large numbers of people. A couple of weekends ago, around the X-ring ceremony, that was a very unfortunate event. That if that would happen in a different location with the same circumstances, the same outcome. So it's not about blaming Saint of X or anybody. It's just the coinciding of that large number of people in the social events with this highly infectious variant, which then, as they travel back to other parts, home to other parts of the province, took that. So that's how we now have this significant spread within especially in the Halifax area. But that is the nature of Omicron. So it's here, but I do take some heart. Our case numbers climbed rapidly, but now have plateaued. So that we'll watch that carefully. But maybe that is an early sign of getting things under control. Our hospitalization numbers, while they're increasing, they're not increasing exponentially, which is a combination of many of our cases have been in younger people, but also our very high vaccination status. That 2 doses of vaccine still provides good protection especially against severe disease, against the Omicron. So I think we can't we can't move away from the importance of vaccination as being part of our success story, and now we need to add in the booster dose. All those factors come together that we have some explain what happened, but also some of the things we have in place that are perhaps helping us out here. But moving forward, we all have to focus on what we've talked about today. Everybody doing their part to slow down their activities and therefore slowing down the spread of COVID over the next few weeks.
John, do you have a follow-up question?
I do, and it's to do with this slowing down advice. We're in kind of a gray area here. We're not in lockdown as such. Stores are open, restaurants are open, at least to 50% capacity, and we can still visit family who have been within our social circle. I know people are in their own situations in terms of family and travel and that kind of thing, but in general, what should we be doing over the holidays that we normally what should we not be doing over the holidays that we normally might do, given that things are still open, but we're being told to reduce our activities?
If I may, I don't think it's a gray area. I think the restrictions should be pretty clear. And what you shouldn't do is put yourself in a situation where you find out you've got COVID and then you're running through, who did I see yesterday? Who did I see the day before? Who did I see before that? And you have this massive list friends and family that you then have to lay and agonize over with whether you've infected them with COVID. So what you should do is everything to avoid that circumstance and limit your contacts. We've said groups of 10 in or 10 in that example. That doesn't mean you have to go find 10 people, but that's the guidance as to what it is. So what you should do is limit your contacts and slow down. That's the way we stop. That's the way we will slow the spread.
Yeah, I'll just add that. I mean, to me, it is really, some common sense that always asking yourself, is this necessary that I do it? And who are the people I'm doing it with? And even a simple thing, like we've now put restrictions on shopping. So really, we're back to where, if at all possible, one person to go shopping. You don't need the whole family to go shopping. It's a lot of this is slowing down, is really common sense about really thinking about what it is I need to do and who I need to do it with, and then stopping all those non-essential things. You use the word lockdown. We're very cognizant of the lockdown has its own set of substantive implications. So this is all about balance. So, and the significant impacts that we've had on people's mental and physical health from social isolation and stopping other activities over the last 2 years. So we're cognizant of that, and that is why we're in limited ways, we're keeping social in interactions between families and people in long-term care facilities. Abilities for people to have some physical activity opportunities for their mental, physical health and connecting with others. So again, it's about balance, but make your choices wisely around that and follow all the rules around distancing, careful masking, all those things when you are out and about.
Okay, we'll go to Lindsay Armstrong with the Coast next. Go ahead, Lindsay.
Thank you, Dr. Strang. Following on that, I understand that borders aren't a focus, given that COVID is in Nova Scotia. You said to slow down and use common sense. Are you concerned at all that without making sort of a stay-at-home request or advisory, that people will continue to travel and potentially spread COVID?
So I think all along through the last 2 years, with the vast majority of Nova Scotians have understood and made the right choices. I don't think we have to put a travel restriction on to have the vast majority of Nova Scotians understands that they need to limit their movements.
Lindsay, do you have a follow-up question?
Yes, thank you very much. I understand that there remains a panorama delay with the high number of cases. Do we have a sense of how many cases are currently active in the province?
I'll be honest, and we don't. We have quite a backlog in terms of cases that are, backlog, first of all, in trying to get to them with their 24-hour notification. And then for many cases now, that's the only contact they'll have with public health. And we're going to entering minimal data when we were able to do that into Panorama. So that really what the source of truth now for case numbers is our daily case numbers coming from the lab. And the more detailed information that we were getting with more detailed follow-up by public health, that is no longer feasible. And once we get through this, whether we ever get to that or not, we'll have to look at that. But right now, it's the lab information which is giving us the bare bones, as well as we're looking at carefully what are our trends in severe disease, hospitalization, with a focus on how much of our overall capacity are we at, and what are the trends of new hospitalizations coming in and the factors around those new hospitalizations. So really, this is an opportunity to shift away from daily case counts and overall indicators of disease and focus much more on what are the indicators of severity, which is part of our transition to a more endemic approach.
Yeah, and I just want to double down on that one and stress it. So, because we do get questions about how many active cases. There's a lot of COVID in Nova Scotia. There's a lot of COVID in Nova Scotia. So the important things, the important statistics from my mind are how many new cases in the run of a day and how many hospitalizations. How many active cases. It would only be an indicator of if there's much COVID around, and there's a lot of COVID around. So people should act accordingly as if there's a lot of COVID around, because there is. A lot of people are getting better. but we just need to focus on new cases and hospitalizations. I think those are the key things.
Okay, we'll go to Pat Healy with the Laker next. Go ahead, Pat.
Hi, this question is for Dr. Strang. Last night in an interview, Dr. Tam said it was time to get rid of the single layered cloth mask and maybe even the 3-ply surgical type mask, with only an N95 type mask being a better fit for people's faces. Will the province be making any changes to what masks Nova Scotians should be wearing?
So we were aware of some changing recommendations coming from the federal government. We weren't aware that they were going publicly. I have people on my team on a national call right now, and that's one of the topics on the agenda. So we'll understand what the federal government is saying. My understanding is that advice was really directed towards both healthcare workers and people who are visiting into healthcare facilities. But we'll take the time to understand completely what any new direction from the federal government and what that then may mean for Nova Scotia. But this is new, evolving information.
Do you have a follow-up question?
Yes, I do. Premier Houston, and maybe Dr. Strang can weigh in. How soon will educators and parents, guardians of students know if they will be returning to in-person learning after the extended break on January 6th, or if they will be pivoting to online learning? What will the epidemiology need to indicate to get kids back in school on January 6th?
Thank you, Pat. Of course, people remember that we pushed the return to school back by a couple of days. That's already happened, and of course, we're always mindful. I see what's happening with some universities that are going to online. So we'd ask our educators and people working in education to just think about what's possible if we have to go there. But the answer to your question of how soon is as soon as we can, and as soon as that decision is made. So we need to see how we put restrictions in on Friday. We've decided to kind of strengthen those restrictions at this stage. It's unusual to strengthen restrictions so quickly, but we're in unusual times, and we'll continue to monitor. And if we need to make that call, we'll make it as soon as we can. So I just ask people to bear with us, and we are optimistic that Nova Scotians will respond as they always have. We'll get these case numbers coming down because we're limiting contacts and we're slowing down. And then we'll continue to watch where we go from there. But thank you for asking that question, Pat. I know it's on the minds of a lot of families.
Okay, next we'll go to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. I guess this is to the Premier. I understand that there's been a lot of calls out for retired healthcare workers, nurses, and so forth to come forward to help out in the labor crunch because other people are self-isolating. There's been concerns expressed to me that some of these people are either being asked to work for free or if they're coming to work on a payment basis, that their retirement benefits might be affected. They're worried about those sort of things. Can you address that issue of what's being done? I mean, is money going to be provided to hire these people back, and will their future benefit situation change as a result?
Thank you for raising that, Tim. I hadn't heard that specifically, but what I would speak to is, I mean, 500 cases. Each of those people had a certain number of contacts. So even if they had 10, well, that you can do the math, and they did 10 today and 10 yesterday and 10. You can see how there's a lot of people across the province isolating right now, and healthcare is not immune. So I wasn't aware of that, but what I would say is to anyone who can step up and return to the workforce that's qualified, obviously, or take an extra shift, we appreciate that. And I hope I've never given the impression that healthcare is somewhere I would look to scrimp and save money. That's not the case. We'll invest what's necessary to get us through this.
Tim, do you have a follow-up question?
I do. Earlier today, there was a quite positive announcement about the budget situation being much better off, hundreds of millions of dollars better off than had been forecast. And you had just mentioned that you had talked with the opposition leaders about sick pay issues. Is there a possibility that some of this unexpected financial health will be directed into supporting workers who can't get to work?
Yeah, of course. We talked about the supports for businesses. We'll look at the supports for Nova Scotians and employees who can't get to work or can't work otherwise. Yeah, for sure. I mean, we're actively looking at that. There's some precedent in the past for some of those programs, so we don't have to start from scratch. So I think to your ultimate question, is we're going to be there to support Nova Scotians through this. Nobody wanted this wave. Nobody expected this wave. It's proving to be debilitating with the potential to get worse. And I know Nova Scotians, I think, understand my focus on fixing the healthcare system. We won't let it crumble right here. We're not going to let that happen. We'll invest in Nova Scotians. We'll invest in COVID response. We'll invest in healthcare. So there's more than a possibility. It's a probability that we'll come up with these programs.
Okay, next we'll go to Chelsea Gould with Truro News. Go ahead, Chelsea.
Hello, thank you. Sort of to follow up on Tim's question, Premier, beyond the current sector impact support program, do you anticipate any more business supports coming during this wave?
You're talking about in addition to the ones that we just announced? Is that what you mean?
Yes, because that targets certain industries.
Yeah, I mean, look, we're looking at lessons learned from last time. We're hearing from different organizations, and we'll do what we can to get people through this for sure.
Chelsea, do you have a follow-up question?
Yeah, this is for Dr. Strang. You've talked about hoarding of rapid tests. I've heard issues in Ontario of people selling rapid tests that they gotten for free. Have you found any issues here with that?
I have not heard reports of that, and if there are people thinking that, I would ask them to think about the common good. All of us giving something out for the common good, and helping us use the supply of rapid tests we have available to all of us for the most effective use.
Okay, next we'll go to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, thank you. I've noticed that there are no new exposure updates for the Antigonish-Guysborough area on the website, not since December 16th. Is there a reason for that?
Two things that we're slowing things down, so there's less exposure, so less notices required. But we also have some of that backlog we're dealing with in public health, so we're maybe a little bit delayed in getting to identifying some of those exposure notices.
Lois Ann, do you have a follow-up question?
Given that this area is one that has one of the highest case counts per 100,000 population, shouldn't there be a priority on updating that area?
So we have COVID all over the province. So, our priority is, as I said, in public health, we are working to make sure everybody who's a positive case through the lab gets first contact by public health, and in many cases it'll be the only contact now within 24 hours. We're not there. We've had some backlog, especially over the weekend, but that is our objective, and we're rapidly working to do that. And so we can't prioritize for geographically until we actually have that first contact anyway. But I think our priority is to make sure no matter where somebody is, if they're a test positive, that they get as as quickly as we can get a contact with public health and are given the information around how to manage their own health, and as well as identifying their own contacts. And then in certain circumstances, especially when we're dealing with long-term care facilities, homeless shelters, the people who are at much more risk in congregate living settings, those are the ones who we're there prioritizing for the more detailed follow-up as urgently as we can by public health.
Okay, we'll go to Drake Lauthers next with the Port Hawkesbury Reporter. Go ahead, Drake.
Over the weekend, St. FX issued a press release saying that the people reporting to them positive cases have plateaued. But have we seen the outbreak in Antigonish and cases tied to St. FX plateau yet?
So I think we're seeing, a lot of the cases there that were result from, the X-ring ceremony. Many of them are now resolved, and their infection is over. They're no longer infectious to others. So that has plateaued, and a large number of those folks are then able to, travel home, and things have slowed down during the exam period, even when students were back on campus. So, not that there's not ongoing transmission and cases in that part of the province like there is elsewhere, but certainly the peak of that, the outbreak associated with St. FX, we're past that peak.
Drake, do you have a follow-up question?
And with the recent outbreak declared at St. Martha's here in Antigonish, are you confident that it can be contained like it was with the Parkland outbreak?
We certainly have very knowledgeable and expert infection control practitioners working in our health system, so within the health authority. So they will be, they already are actively working at that and the other hospital outbreak as well, to put up measures in place very quickly and to contain those outbreaks.
Okay, next we'll go to Preston Mulligan with CBC. Go ahead, Preston.
Hi, a couple of short questions, and I'm happy to scroll back if you've already answered this, and you can just let me know. But for those households that are used to testing almost on a daily basis with take-home rapid tests, what's your recommended, this is for Dr. Strang, what's your recommended protocol there? Should they reduce that somehow? Well, how would you advise a family, say of 4 or 5, who test almost daily because of their constant potential exposure because of their job or whatever? What would you recommend?
Well, we're focusing people, to really not use tests for those ongoing daily testing purposes. If you already have test kits, we're not going to ask them back, because you may be in a situation where you meet one of those criteria more on symptom-based testing, or if you're identified close contact. But also then, if they have family and friends who are you're going to meet our new criteria for testing, and you have test kits, share your test kits with those. Let's make sure that the test kits we have available will be used for the prioritized and most important needs. And there will be more detailed information in the next couple of days on that. But we just need people to understand now that regular daily asymptomatic testing is just not something that we have the ability to support or should be doing here now in the midst of this COVID surge.
Preston, do you have a follow-up question?
Yep, quick one. Is there any request or is there any negotiation happening whatsoever with the federal government for any kind of help with what's happening here?
So, I mean, as the Premier's outlined, requests have been made from his office and from the Department of Health and Wellness to speed up delivery of vaccines. We've had ongoing requests. We continue to push the federal government to maximize their allocation of test kits to Nova Scotia.
I meant military, I guess. Sorry, I should have been more specific.
We are putting a request out now, people on my team, to making a request to Canadian Armed Forces for how they might be able to support our vaccination efforts in the new year, like we've done previously. But we're not going beyond that at this point in time with the armed forces.
We'll go next to Sarah Deary with Radio Canada. Go ahead, Sarah.
Yes, can you hear me?
Yeah.
All right. So I don't know if I missed it, but you have the data for the number of Omicron cases in the province.
We don't have I don't have a total number. What I do have is what I received yesterday, the latest batch of, because you have to understand that we don't send every specimen for confirmation whether it's Omicron or not, but the latest batch of samples that were submitted to the national lab in Winnipeg, when they came back, 83% of them were Omicron. So it's pretty clear that the rest were Delta. So it's pretty clear that Omicron has rapidly become the dominant strain here in Nova Scotia. Not a surprise. Same thing is happening in other provinces.
Sarah, do you have a follow-up question?
No, I think I'm fine. Thank you.
Okay, we'll go to Jonathan McGinnis with CTV next. Go ahead, Jonathan.
Hi, good afternoon. Thank you for taking my question. People who are being tested are being told 24 to 72 hours is the typical wait time. We're hearing of a number of instances where results are coming back far after the 72 hours. Is that expected given the number of tests that we're doing, or what could you tell people who are still waiting for those tests?
Yeah, I saw data yesterday that the vast majority, I think it was around 70% of people were getting the result within 24 to 48 hours. There was about another 4% that between 42 and 72 hours. A very, very small percentage were beyond that 72-hour mark. So we'd ask those people to, to be patient. There is a line that they can call to try to get help getting their test result. But even given the large volume of testing, the fact that we're able to stay to the majority of people within that 48 hours and then the next group within the 72 hours, to me is a testament to the incredible hard and skilled work by our lab colleagues.
Jonathan, do you have a follow-up question?
I do, and I was preoccupied there just for a moment, so this may have just been asked, but given the success of rapid testing for asymptomatic carriers of COVID, why are we now restricting rapid tests to those experiencing symptoms of the virus?
It's simply that we have, finite resources, both for PCR testing and our rapid tests. We are working to expand as much as we can our supply of rapid tests, but no matter what we do, it is a finite resource. So we have to, the pressures of COVID require us to adjust, and we have to allocate resources to highest priority needs. And we're at a point now where we just can't afford the luxury of having people just test because they'd like to know their status on an ongoing basis.
And that is all the time we have today. Apologies to anyone we didn't get to. Over to you, Premier, for closing remarks.
Well, thank you, Marlon. Thank you, Dr. Strang, and thank you to some very thoughtful questions. Really appreciate that. The message is simple: slow down, spend time with a small group of close family and friends. It's tough. It's tough on everyone. I'm no different. I had to call my mother yesterday and tell her we couldn't come for Christmas dinner. That's a tough call, no matter who you are. So, but the reality is, if you don't need to go there, or you don't need to do that, or if it's not necessary, then you're safer to stay home, and this is the time to stay home. So checking on your friends, your family members, your neighbors who live alone, or those who are sick or isolating that may need help, and show them the true meaning of the holidays by supporting them and offering them help. This is not the holiday that you expected. It's not the holiday anyone expected. But still, I wish you and your family a safe holiday, and I hope that 2022 brings you joy and good health, and sees us get through this pandemic once and for all. But thanks, everyone, and I really appreciate your support. Thank you.